Hi everyone, I am Dr. Rahul Gupta, Senior Cardiologist working at Apollo Hospital in Mumbai, Navi, Mumbai area and Director of Cardium Advanced Heart Care Clinic. Today I am going to discuss about an interesting topic, salt and your health. So what does salt contain? Salt contains two minerals, one is sodium and one is chloride. Now sodium is a mineral which is responsible for regulation of fluid in the body. It is important for nerve function, it is important for muscle function. So it's an important molecule. But when it becomes extra, it can be harmful also. And when there is extra salt in the body, there is a water retention, and when there is more water retention, the blood volume increases, which causes increase in the blood pressure. And we all know that blood pressure is a silent killer, and blood pressure impacts our body in a lot of different ways, which we will discuss in a different scenario. Now this salt response varies with age, varies with ethnicity, race, patient's gender and some disease condition. So somebody who has got diabetes will respond in a different way to the salt, and therefore we find different salt sensitivities in people. Now there is a question, can you take more salt if you don't have BP? Of course not, because if you take a lot of salt, there are a lot of other illnesses beyond blood pressure which can occur. So even if you don't have high blood pressure, even if you don't have any disease, please don't take too much of salt, because if you reduce your salt, you will reduce the chances of high blood pressure, heart attack, stroke, heart failure, kidney disease, bone health like osteoporosis and all. So therefore it is very important that you still take less salt. And do you know that most of the salt which comes in our diet is from the packaged food, because a lot of salt come through these packaged food, and even if you are not using the salt shaker, you already have a lot of salt if you have, because the requirement is usually met naturally when you eat food. So you actually don't need too much of salt. A little bit for the taste is absolutely fine. So what is the practical advice to reduce the salt? If somebody asks you to eat bland, the life becomes miserable, because you are used to a particular taste and all. So you start reducing salt very gradually. So that's my practical advice. Typically for hypertensive patient, we say don't eat more than 6 grams of salt, but otherwise you start reducing bit by bit. So if you are used to a particular amount, reduce a little bit, and that's how your tongue gets adjusted and you will never feel miserable. So this is how you deal with the salt, and salt is so important for maintaining your health. Don't go excess. Thank you very much.